Hello, Kyle.
Hello, Chad. Lafayette. Hello, Suzanne. Good morning.
Morning.
Good morning.
Or at least we haven't seen each other.
I'm actually at my best at this time, so I'm grateful for the hour. I'm not good at night.
Yeah, I've been up since 4:30, 5 o'clock my time.
Yeah.
And, you know, I've already made a stew and did a little cleaning, and I'm ready for a little sit down and learn.
Let's say.
Sorry, everyone. I'm not really sure what happened, but I'm sure everybody is trickling back in gradually.
Yeah, for some reason it stopped recording and then just totally dropped.
Yeah, I'm not really sure what happened, but
Zoom is a finicky platform.
Good morning, everyone. Alafia.
Good morning, Sophia. Yeah, sometimes when you're trying to bridge so many different countries, the signal goes kind of wonky. And you can just totally drop.
It says it's still being recorded though, so
maybe I should stop recording for now and let the speaker come back.
The speaker is saying she's continuing to give the presentation, but we can't see her. We can't see you.
I'm here. I can see everyone, but I don't see the speaker at all. Can anyone?
We don't see the speaker. We don't see you.
if they go back to the link that was in the email and click on it, it'll kick them back into this right here because they kicked everybody out. But if you go back to the email with the link for the Zoom, it'll kick you right back in.
She's trying to come back.
So Suzanne, since you got all the stew ready, we're all gonna come over for dinner then, huh?
Well, actually, it's breakfast stew.
Okay.
It's a rice stew that they make in China and Japan a lot. And it's kind of like, it's a thick, gooey, like rice stew with some chicken and onions and various things. It's a really neat way to get going in the morning.
I was gonna say then I'll come over for breakfast then.
Okay, you're more than welcome here in Fargo.
Okay, I'm on my way.
Pascalia, we're so sorry. We don't know what happened really.
I am back. Am I back?
You're back, but we can see your presentation. So
yes, I will share my presentations again. I don't know where I lost you. Sorry. I thought
you had the theoretical framework. You were walking us through the framework. So if you yes, that slide. You're looking at the theoretical
this
framework.
one.
Yes.
Okay. So I used a balanced growth theory, and I said that Gant said that an economic that exploits people is an evil economy, is evil, it's an injustice. And so he proposed to working with people for economic equality, common good, and welfare for all. Also, Amartya Sen, whose development he puts that human beings must, development must put human beings at the center as drivers of the process, not objects of capital accumulation. And I'm also using the indigenous, the Kalenjin philosophy of social philosophy that says it is math. Math is the belief that social justice and fair play is a way of maintaining harmony with community. Math code of conduct demands that people communally look out for each other and seek the welfare of every other person. As I said before, that math puts obligation to members of the community to look for the welfare of everyone, and even in terms of economic exchange. We will see that more. Kigre is the code. It gives what is right and what is wrong. You will see that as we move along. So let me take you first then to the first part of this study. And the first objective was the economic knowledge and practices, which were, as we said, communal. So one is, among the Ndorais, beekeeping was one of the economic practices, farming, sorghum, millet, keeping cows and goats, sheep, and hunting. Now, the practices of acquiring this, the wealth that they have, besides what I've just given above, is that the animals, the cows, the cattle that are in the community at the moment, according to the community information, was from a raid that they conducted in 1900, and they have not conducted any other raid since then. So the cattle in the community issue from that first raid. So when they went for a raid, whatever they got was divided, and that has been what they have been taking care of to date. Of course, there is an addition due to ceremonies and rites. Now, in this community, when a child, both a boy and a girl, from the age of 10, 13, 12, they used to remove the lower teeth. Am I still there?
Yes.
Okay. They used to remove the lower teeth. And it became a tradition and a cultural, it became part of beauty. But actually looking at it, it was a medical, the reason was really medical, because if I'm sure you know about the tetanus. So tetanus is also called a jaw lock disease. So when somebody contracted tetanus and locked, there was no way to feed and give medication. So the community removed the lower teeth. And so to make it part of dressing and part of something acceptable to everyone, so they made it part of a cultural. And anyway, so removal of teeth, when you remove the teeth, you were given a goat as a gift. If you pierce your ears, they were given a goat, or a gift by the family. Also through initiation rites. After the initiation rites, they are gifted cows, goats by the clan, by the family, and age sets. During marriage, a man was given cows by the family as an inheritance. For a woman, a lady, the day she goes to the husband's house, the family, the father and mother-in-law, she's shown her part of stock. And before consummation of marriage, she's given livestock by the husband. So that when she's taking care of the livestock of the family, she has is there. So, and another one is kinship. Now, among the Tugen and the Kalenjin nations, kinship is very important. And therefore, a member of your mat or a family, and kinship here, I'll tell you later on, is that any member of the family cannot be allowed to be poor or, let's say, have no livestock. It is seen as being naked. You have no dignity. And therefore, members of your family, your kinsmen must clothe you, must cover you. And we call this ngor. You are given ngor because you don't have. So covering poverty of a kinsman or a friend by giving that person livestock. So if, for example, I have no cow at all, my mat, my family gives me, I take care of these cows until after a very long time, they take the principal cows and each one gives me a cow or two, and that becomes mine. So you begin building your economic base beginning from there. We also have hunting, and this was very, very restricted. And even if you are given permission to hunt, you have no respect in the community because they seem, you are seen to be having red hands. This is bushmeat. You can only do when you are really hungry and you have no option. And there are also restrictions along that. Practices of distribution of resources. There were practices that were meant, or let's say, ways that were meant to make sure that each person has something. And one of them was putting Kikre code of conduct. For example, Kikre is associated with wrong sin. For example, they place restrictions to guide extraction and use of land resources. It is Kikre, for example, as I said, not to give ngor to your kinsman, not to cover the nakedness of your kinsman. And therefore, if you don't do it, you are breaking the rules. It is Kikre, for example, again, if a mother who is having kids and does not have a milking cow, she has the right to go to any neighbor who is milking cows. You put kote is something, if you can see me, a small calabash that we use to feed babies and kids and lambs and calves. So you put it outside the enclosure. The person milking must fill that gourd with milk before distributing. So if you refuse, that is Kikre also. It is Kikre to go and hunt bushmeat and you kill a female animal. And also it is Kikre to come with the bushmeat and eat it alone. You just cut a piece that you need for your family, and the rest you put it at the highway, at the crossroads, so that anybody else who is hungry can have it, so that the rest do not have to go back to the bush and kill. You must share. So those are many, many examples. You cannot also go and cut trees in the forests. If you need beehive, it is Kikre to cut down a tree by the trunk. You can cut the branches, logs that, and even if you have 10, you can only take 2. You cannot take more than 2, so that the remaining 8 can be given to others so that they don't go back to the bush to cut another tree. So there are so many of those Kikre. Another way of promoting resource distribution was through kinship. I already said that. Community rights. And I said again, in the community, people are related to each other in so many ways. And those relationships put obligations to make sure that you protect the dignity of that person. The whole community will feed your children or my children if I don't have food. So those are ways of ensuring that there is distribution of resources. What are the socioeconomic values? There are many values here. Hard work. If you remember, I said that you are not given anything for free. Nothing is for free. You must work hard for it. Either you must work hard through working hard, or through behaviors, sharing, honesty, the life of the community here, the survival of the communities on honesty. Because if you are poor and I must give you my livestock, I am sure you will not cover it and one day say that I didn't have or I was not given. Reciprocity is another one. Trillianity, at the center here, I've put something called trillianity. It is an institutional relationship in the community. Trillia is somebody who comes to you because she needs help or he needs help, and you must give. You come to me, I must give you. I come to you, you must give me. Here, trillianity says that everybody has the right to borrow. And remember, wealth here was not hidden. It was not like money that goes to the bank. You can have millions in the bank and you live like you don't have anything. If wealth is cows, land, honey, grains, everybody knows that you have. Even children are wealthy, because a woman who does not have kids can be given a child so that she is called a mother of. So all this is seen as wealth, and therefore there was not something you can hide. A respectable person is somebody who had many trillion. You know, if you have wealth in terms of milk, then that is meant to feed the community. It is meant to feed the kids. Therefore, people respect you because of that. I have given here an example of a sharing the parts of a cow. Here in the community, it is great to slaughter your cow and eat it. You don't slaughter your cow. You call somebody who doesn't have food, or somebody who is poor, for example, because he has his part that you will take home to the children because he has slaughtered. And if you look at this diagram here, you see that there's every part apportioned to somebody. The first one, gusto, is for Asis. Asis here is God, the supreme. And Asis means is given to anybody who is a stranger. It is for a stranger, somebody who is passing by the community. Is not a member of that community, or is a stranger, is a visitor. He has a piece. If there's no visitor, it is put in on the highway where somebody else who is hungry can eat it. Then we have the part of the elders, the fathers, married girls of the family. They are taken to, and grandmothers, the warriors. So it is ordained that these parts belong to this, so that no one can slaughter a cow and eat it. You must slaughter a cow and feed everybody. So if you don't have an elderly grandfather in your house, that part is given to any grandfather the age of your grandfather in the community. Okay, so what are the dangers of displacing these practices? Number one is the loss of ecology. Now, when young people no longer subscribe to these indigenous ways, they cut trees. They no longer believe in Kigrey, so they cut trees anyhow, even the trees that were never allowed to be cut. And so they cut trees, they cut sacred trees anywhere, meaning loss of water streams, and then loss of wildlife when hunting is done unrestricted, or because Kigrey is no longer there. Loss of swamps, land holding capacity is reduced, because here, when there are people who have a lot of money now, so they buy away the poor. They go to the community, they buy land, they demarcate that land, and therefore the grazing areas become personalized. So the holding capacity is reduced. And reduction of livestock also follows reduction of the holding capacity. Because people cut trees to burn charcoal, smoke chases away bees and therefore reduction of honey production. Effects on equality, because of formal education, the people are salaried. The form of wealth has changed from livestock, grains to money. And therefore, these people who get employed no longer consider social solidarity as a cushion for as it was. They now depend on their salary rather than community solidarity. And the socioeconomic exploitation by the elites already said that resource shift from communal possession to the hands of a few individuals. And loss of Tiliandi. Tiliandi is that you no longer know when somebody has. Somebody cannot come, you just don't go to somebody to say, you know what, I'm having a problem here, please give me a few cows, or give me a few pots, or give me some drums of honey, or give me a sack of millet. That is getting lost. Therefore, the values of sharing and covering each other's nakedness is seen as anti-development. Okay, effects on social life and responsibilities. Social disintegration, individualism. And this has thinned social bonds through weakening of age group to class society. Now, in the community, age groups have responsibilities over each other. You find that a child has a responsibility over the family, whether extended, even the clan. This one is thinning away because people move from the community to look for money, and therefore the performances of rights that were building the bonds in the community become something that is kind of superficial. That seeing the community, now the family as a burden, a family is a liability. So you narrow the family to just the mother, father, children, and you leave the rest. Loss of sense of social responsibility and math. Investing in social capital replaced with investment in material assets. And I said again, shrinking of family, and exodus of young people out of the community in search for money. This is where capitalism is coming in very fast into the community. Now, what are the interventions to safeguard this? According to this study, one is the restoration of endorsed rights and ceremonies, because these rights and ceremonies led to the observation of ethical and moral standards. When we go, through rights, people are educated on the important values of protecting the community, of integrity, of generosity, of respect. And this one is, these are rights and ceremonies become spaces on which these ones are given. This behavioral management is done through indigenous ceremonies and rights. In these indigenous ceremonies and rights, social values are strengthened. Values of family, community, they are disseminated through these rights. Another thing that I said here, and maybe not so much in this presentation, is the role of spirituality, because the community spirituality, social life, the line is very thin. Okay. Ndasum is a prayer for men and the whole community. Keretabek is a prayer done by women. Now, when the community realizes that there is this harmony, probably because of doing things wrong against nature or against themselves or against the supreme, this harmony can be restored through cleansing the earth, cleansing the community through Ndasum or Keretabek. Now, restoring communities' values, especially, for example, Tigray, because Tigray is actually related to sin, related to going against the supreme and the people. So Tigray teaches the parameters and it determines what is acceptable, used to order right behavior and harmony. And this one is done through restoration of Ndasum. It is related to the spirituality life of the people, which guides the social behavior as well. So I said Ndasum is a platform of reconciling the broken harmony, as well as Keretabek. And so strengthening indigenous values based on material culture, vocabulary, and all that is important in order to restore values and practices and values. Okay. So what were the findings in this study? Looking at all the 4 objectives, number 1 was that Ndorois had 3 types of wealth. We had economic wealth, social wealth, and nature. And these 3 investments were protected by values, Tigray and Ndasum. Now, practices of acquiring distribution of wealth was protected, every member has had what I said, universal right to wealth. You remember when I said processes of acquiring wealth for both men and women, boys and girls. And therefore, this is what I call right for everybody to access distribution of wealth. Community rights and ceremonies provided opportunities for individual upward ascent, economically and socially. Another finding is that intricate social responsibilities and obligations of the family to the community enabled equal distribution of economic wealth among them. And the rest provision for women to acquire wealth was there. There is also what I call intergenerational conflict over resources. Now, this is brought about by, I'm comparing elderly people of older age sets and the younger age sets who have access to formal education. And in most cases, after going through formal education to university, majority don't get employed. They come back to their elderly parents who most of the time never went to school, but still have their wealth. So going through formal education does not, in most cases here in Kenya, prepare the person, does not give the person knowledge of indigenous ways of creating wealth. So when they finish universities, they come back home, they don't know what to do with themselves. They have no knowledge of thriving in the community. They begin to fight over the resources with their grandparents. And so they want this land to sell. They want their livestock to sell to get money. And yet these parents see that as their, what is cushioning them at the moment. So creating that conflict. There is an interplay between, there's what I call reversed economy. In this study, reversed economy, I'm looking at the indigenous, in the indigenous ways, a child of 10 years below has no income. I mean, has no economic, they have no wealth. But beginning from 12, 13, 14, they begin to acquire goods through rights. By the time they are 25 years and are married, getting married, they have an economic base. When you compare with the young age sets, going through school, by the age of 25, you finish university, you are at the same level as a child in the indigenous system of 10 years because you have no income, you have no wealth, you have used your parents' wealth, and you have no employment. So you basically have nothing. You are like a child in the indigenous systems who is 10 years because they are still young. So that reversal of economic reversal, comparing the two. And then I said also mismatch between what is taught in formal school and economic reality in the community, that after education, formal education, the people don't thrive at home because they are not given the knowledge on how to use the environment to thrive. Unlike informal, and there's no integration of both. And actually, you find that people who have finished university, they see indigenous forms of wealth creation, like taking care of cows, going to the farm, as backward. It is not meant for people who have gone to school. So what is the contribution of Endoro's practices? Number one is it does not promote charity. Instead of promoting charity where you are just given, it strengthens the social networks, the social bonds through which resources cycle. Okay. So there is no opportunity of people to be given anything free. And therefore people must work hard. And when you work hard and you strengthen social bonds and social solidarity, resources move, and therefore community is able to push on itself. The second one is when you look at the wealth of among the Endorois, wealth is meant to build relationships, to strengthen community bonds. Wealth is meant to make sure that the community and everybody has got enough. Wealth is not built on not having. Wealth is built on having, and therefore it is not for profit. Okay. Finally, the conclusion is abandonment of African indigenous systems and adoption of Western capital systems are direct causes of socio-economic and ecological crisis in Africa, Endorois for this case, and African indigenous economic practices based on social and economic environmental values, in particular Endorois, can contribute to the designing of an economic model that promotes equity, social well-being, and ecological protection. I leave it at that. Thank you very much.
Fantastic. Fantastic. Thank you so much, Sister Pascalia. That was, you took me back home. You took me back to what the tradition is, what the tradition is and what our culture is. You really took me back to how we started. Thank you so much. We will leave the floor now to questions. We have questions for Pascalia. The time to ask her is now.
Welcome. You may not see me because my camera is not behaving well. So please go ahead.
Okay.
Thank you.
Yeah, we can hear you. Please, if you have questions for Pascalia, please let's go ahead and ask her questions. She's really done a good, she's really dissected what the Kenya culture is around ecology and social economic empowerment and degradation currently going on. And I can say it's getting worse by the day. So please, let's ask her questions.
This is Ia Suzanne from IFA Foundation. I especially wanted to thank you because this explains a lot of what the indigenous Native Americans are facing. They have a very similar culture that they came from, and they're being the conflicts with the Western culture that's being imposed on them. So this has explained a lot to me about what my neighbors in various tribes and reservations here are going through. So I thank you so much for your presentation. It explains so much for me.
Thank you very much, Suzanne.
Yes, please, Yalinda, please go ahead.
Yes, I was just curious about how I noticed we talked a little bit about the capitalism and how it's affecting, the tribes in different areas in the culture. So I'm wondering, how is the capitalism? Are people going and getting educated and coming back, or are they going out? Because I know that capitalism does carry a heavy transformation on indigenous tribes.
Okay, thank you very much. I will be very quick here. Let me look at it in various angles. Number one is that it has changed the meaning of wealth, for example. And here, if wealth is, there's introduction of money. And when introduction of money, an introduction of education, an introduction, so very few people get educated to the point that they can now, education is a way of getting money. Mm-hmm. And so more money or lead to changing the structures and the ecosystem of the community in terms of, I have more money. Let me say it introduces the values of the new liberal economic model and values of individualism, values of inequality and all that. Because if you have money and you can buy the community and you can buy it for yourself, then already the question of social welfare for every member of community goes away. In other words, what is happening is that people find money as a mechanism of protecting themselves rather than using the society to protect itself. So you see where the values of neoliberal economic model is coming in, and it is a quick way also of living rather than the living among within the community system. It moves the idea of wealth from community to individual, and it changes what wealth is. So yeah, it's kind of vast.
Yeah.
Yeah.
And sometimes, or most times, when the people or the youths, when they go out to seek education or to seek knowledge, Western knowledge, what we have observed over time is that they usually don't come back, because the definition of wealth is how much money you have in your pocket, and not the communal wealth that it used to be. So the question, is they go, and once they get that monetary value, that is their own definition of wealth, they tend not to come back home to continue the communal, to observe the traditions and the customs. And over time, they begin to identify the traditions and the customs as a burden and archaic, and it's not modern. That's not what's trending. It's not the modernization of what's happening. It's not civilization. So anything outside material, anything outside money and Western education for them is not civilization. So going back home and observing and continuing the customs and tradition to them is not relevant any longer. So that's what we're beginning to see. And that's why you see a lot of young people moving out of Africa and not coming back. Thank you. I hope that answers your questions, Yalinda.
That sure did. Thank you so much.
Yeah, thank you. So Olivia, to you, your question. Olivia, yes, please go ahead. You're muted.
I'm sorry. Good morning. I was wondering, did you say the people live right now on a national preserve? And if they do, does the government support like cultural education or anything like that to help the people?
They were moved from their own land to a land that was not productive at all, and therefore their capacity to do things for themselves, their capacity to, to feed themselves, their capacity, even their own economic well-being was destroyed because of that. They lost cows and all that stuff. And so again, the government relegated on the promises that they had given, that they were going to be given schools, water, and so they were left for many years in abject poverty because one, the land was not good enough for their livestock. There were no provisions. And so those who are, their situation is not is good yet because they're still struggling within that. So what is good is that they have been given back the land, and the process of returning the land back is still ongoing, but their situation has not improved much, given that they have been uprooted from all that was provisional to them in terms of economic well-being, community, and all that. So the government, in short, was not able to provide his part of the bargain.
Olivia, were we able to answer your question?
Oh, yes. Thank you very much. I
Yeah.
appreciate it.
All right. Thank you. I don't see any more hands. And if there are no more hands, I would really like to thank Pascalia for her lecture. That was quite deep and very indigenous. And we will surely have people ask more questions before the end of the lecture. And so just sit tight and we'll still come back to you. Having said that, I'll quickly like to introduce. Oh, yes, Titi is asking if we can have your slides. So Sister Pascalia, if you could share your slide with Dr. Segon, and she would send that to us. I will share with the people who have participated today. So thank you so much. I would like to introduce our second. Yes.
Thank you very much. Thanks. Yeah.
Yes. Please, Pascalia, do not leave. We'll still have you say one or two things before the end of the lecture. I would like to introduce our second speaker, who is from West Africa. He's from West Africa. He's from the southwestern part of Nigeria. His name is Dr. Oluwatosin Adeleke. Dr. Oluwatosin Adeleke is a Yoruba man. He will tell us where he's from, if it's Oyo State, Ogun State, or Osun State. I don't know, but he's going to share that with us. He's a director of clinical psychology in the Department of Psychiatric Hospital of Ahmadu Bello University Hospital Zaria in Kaduna. He's a clinical psychologist by training. He holds a diploma in law from the Ahmadu Bello University Zaria, Kaduna. He obtained a PhD from the University of Ibadan, Oyo State, Nigeria, and is currently an assistant director. And he has served in many capacities. He was appointed a member of the board of Kaduna State Substance Abuse Agency and has been involved in working with individuals and families of people affected by substances. He's also the director of drug abuse prevention and treatment in the Diocese of Kaduna Anglican Communion. He has served in various capacities, which includes social scientist in various funded international studies in northern Nigeria. These studies involve mental and behavioral disorder and effects of chronic disease on the well-being of patients and caregivers. As a team lead social scientist, he has just concluded a study that documented the well-being of people affected by stigmatizing, neglected tropical disease of the skin and establishing a care and support group within the community. He's currently working on developing a well-being tool for parents and children with various forms of disability, and is the program manager for the Depression and Genetic Study in Africa, which is also a multi-country study. His work has led to collaboration with several institutions, among which are the University of Edinburgh, Liverpool School of Tropical Medicine, Institute of Development Studies, United Kingdom, African Program, World Health Organization, and the United Nations Office for Drug and Crime. Apart from earned degrees, he has also attended various short courses across the globe. And I present to you this morning, afternoon, or evening from wherever part of the world you're joining us, Dr. Tosin Adeleke. Dr. Tosin, over to you.
Thank you very much, Loretta. Can everybody hear me?
We can hear you, but we can hear you, but we cannot see you.
Okay.
Yes, we can see you now.
Okay. Okay, so good morning, good afternoon, good evening to everyone. And over the next few minutes, I'll be talking about the sociocultural influence. On care seeking pathway among persons with substance use disorders. And that's just a picture of somebody embarking on a journey. And we all know that healthcare generally is a journey, and that's the journey that we want to look at today. Loretta has beautifully just explained who I am. I just like to say that I'm from what is called the north central part of Nigeria, but Yoruba by origin. We usually can trace our culture. Well, I can trace my family back to Ife, but I was born in northern Nigeria. I schooled in northern Nigeria till after my first degree, and then did a master's and PhD in southwestern Nigeria. And sorry, the room now looks a little dark because, as usual, power has just gone off. Okay.
That's a Nigerian factor. It couldn't just hide. It couldn't just pretend and hide itself.
Yeah, it couldn't just pretend. So I'm going to get up for 2 seconds to put on the solar.
Apologies. That is what happens in most parts of Nigeria where we have power supply challenges, and that cuts across Africa as well. But we'll get there someday.
Yes, that's true. Okay, so and I've worked for over 27 years now in mental health, including substance abuse. Something significant happened this year, 2023. The mental health law was passed into law. Mental Health Act was passed into law. It was quite exciting for us because what we have used prior to now is a pre-independence act. And we have run that for over 50-something plus years. And that was quite a significant thing for us. And I'm saying this because it will affect a lot of some of the things that we'll be talking about when we talk about care pathway. What has happened over the years is that everything has been left to the discretion of whoever is doing whatever at a particular time. What does that mean? It means that if a group of professionals came together and said, when it comes to substance use disorders, this is what we need to do, well, a few people just went that way. And then if another group came, then people went the other way. Then WHO comes, oh, then we go that way. But it's not binding on anybody. And it really was a problem. Now, I've worked in several communities, in Kaduna State, in the Southwest, worked in quite a number of communities across West Africa. And in recent times, we're beginning to see different levels of implementation of mental health across West Africa. We have different levels, we don't have as much professionals as the Western cultures have, as the Western countries have. So there's still a lot of traditional involvement. And that's why today we're talking about culture. Now, just a little bit about statistics. Cannabis still remains the most widely used illicit substance in the African region. And we have that percentage for West and Central Africa. Then when you come to Nigeria, we have about 14.4%, 14.3 million aged 15 to 64 years. That's, as you will all agree with me, the most productive part of a nation. And within the geopolitical regions, the National Drug Law Enforcement Agency gives us the percentages per geopolitical region. So it's something that is out there. It's something that is a big thing. And that's why to look at the care pathway is very critical. But to look at it, we must look at the culture. And the previous speakers talked a lot, though, about ecology, but really said a lot about culture. And we know what culture is, the ideas, the customs, and the social behavior of the people. And then what acculturation is, and that's the assimilation of a different culture. And I'll show you why I talk about acculturation. Okay, so you can't talk about community, you can't talk about health today without referring to the community. The individual is a part of the family is a part of the community. And in Nigeria today, we have primarily, like most other places, the urban, the peri-urban, and the urban, the rural, the peri-urban and the urban communities. And that first one there is rural because it's primarily homogeneous. But then we have a fourth category today, and we now have what you call insecure neighborhoods or communities. And when you look at the description of insecure neighborhoods or communities, they're mainly fragmented, people who have migrated from other places. We are currently doing a study looking at migration and how that works with health care. And people are coming from a different culture with a different belief, and they come into a new culture. And many times what happens here is they just merge in, and it becomes a mix, kind of. So that whatever you want to do amongst people, if you have not engaged the relevant people within the community, it becomes quite difficult, to really push forward a lot of that. And we'll see that as we go on. Okay, so what are the cultural beliefs about substance use, substance abuse? In some cultures, it's an accepted practice. So you have rituals, you have community programs, you have things like burials, and alcohol is accepted without really looking at the quantity or the quality. You have fermented roots, fermented plants, and in some cultures, it's mind altering for improved spiritual experience. And this is quite critical, because when you now come to talk about community involvement or community participation, and we are looking around awareness programs, then you have a problem, you have a challenge with those conversations. And if the conversations are not engaging, people tend to go away feeling, okay, they've come from outside, they said what they need to say, they've gone, and that's it. That brings me to another critical point where we talk about accepted practice, and that is the issues around stigma and discrimination. For many other cultures, discrimination, it's a lot of stigma. In other places, it can be very negative. Such people are referred to as people who are ruining our society. So there's a lot of exclusion in social activities. And we've seen that a lot of this exclusion really doesn't help. If anything, it makes things, what we've seen in quite a number of the communities is they've excluded to a particular corner, started another subculture within that culture, and are beginning to influence others in the main community who were not part of them. Then others perceive it as self-afflicted. Then there's also the criminalization and seeing it as evil. And most individuals from rural areas are reluctant to seek treatment, because of perceived stigma. Remember that we're looking at the pathway to care. So many just conceal and keep concealing until it's out of hand, before they begin to seek treatment. So still looking at the cultural relationship. Now, the experience of culture precedes the influence of clinical experience. Now, I'll show you in later on slides, you will find out that a lot of what we're doing presently has to do more with clinical experience, treatment setting, coping styles, social support, and then looking also around the issue of stigma. Okay, so it's going to be quite noisy now because, again, it's raining. We're in the heat of the rainy season in this part of Nigeria. So if you see that my voice is a little louder, it's because of the rains. Now, culture is also related to mental health and substance abuse. There's a higher risk where there are stressors, where there's discrimination, where there's isolation. And the impact of all of these cultural issues, people feel that there's no need for treatment. It's not a disease. It's not sickness. Why am I going to the hospital? We only need deliverance because it's evil. Because it's criminalized, the only thing we need is law enforcement. Then delays or refusal to seek care. Then treatment is pushed back as a last resort. After we've tried every other thing, then we come to treatment as a last resort. And then where there is relapse, it's considered a self-inflicted problem. He's going back. He knows what he's doing. These guys, they are just trying to make a fool of us, and all of that. This is all tied to the way the culture perceives a lot of this, and the social impact is on the family, the community, the health of the community, education, more people dropping out of schools, more people not completing school, a lot of gang wars in schools, crime, banditry, insurgents, kidnapping on the increase, and then the impact on work and employment. So people are employed, they are not productive, and it's all tied to the cultural belief that this is a self-inflicted thing. Now, the current practices, primarily, apart from all others, tertiary-based, private-based, and faith-based. Now, in 2020, Wango and Co. looked at community readiness for drug abuse prevention in southeastern Nigeria. And using the community readiness model in 2 rural communities, including key informant interviews, they found that these communities were at a vague awareness stage. In other words, they were aware of the problems of substance abuse, but they had no specific plans. And because they were at this stage, they were very vulnerable due to low levels of awareness. What does that mean? What does that say? It means that, well, we know that it's there. It has always been there. But we have no plans to deal with it. We have no plans to tackle it because of the primary perception of it as it's evil, it's criminal, that's not our business. The people who should do it should go ahead and do it. So it continues to fester, it continues to grow, and they just keep identifying, oh, another person has joined them. Oh, this other child has joined them. Okay, talk to your children and tell them not to join those people without specific plans. So why are we talking about communities when it comes to substance use, particularly community in Africa? We know that globally, equitable access to healthcare is a major principle. And that equitable access has to do with geographical accessibility, affordability, accessibility of accommodation, timeliness of service, acceptability of services provided. Now, if I start from the bottom, acceptability of services. Now, a lot of the services, because of the mindset, because of the sociocultural perceptions, a lot of the services are not accepted. What you find many times, and we'll see that as we go on, what you find many times is people who have gone to homes, areas that are secluded, where they do a lot of inhuman, dehumanizing treatments, flog out the devils out of them, you know, and things like that. So they're not accepting the services that have been provided. And like I said earlier on, many of it has to do with lack of awareness. But we know in all the health programs that community participation is key. And that's the process by which individuals and families assume responsibility. We're seeing in quite a lot of countries now, elimination of certain diseases with a lot of community-based participatory models. And that's why we're looking at it from this point of view. Because at this point, community takes responsibility for their health, adoption of behavior to prevent and treat a disease. But that's where they believe that it's a disease. Okay, and there are 3 ways that they do it: forming groups, participating in joint analysis action plans, and I'll talk about that later on towards the end. Self-mobilization, where there are self-help groups. Now, I must say this, a lot of our communities, particularly in Nigeria, northern Nigeria, have self-help groups, community-based organizations, village health communities. These structures are already there. The issue is adequate engagement with these communities. They've been engaged in other programs. But again, that takes me back to the first slide about the mental health law.
Yeah, I'm sure the rains is likely influencing the network back there in Nigeria. So it's likely we have lost Dr. Tosin, but I'm sure he will get back on. Can everyone hear me?
Yes.
Yes.
Okay. Yes, so I'm sure he will join us soon. Let me just send him. Yeah, I'm sure we lost him. Yeah. Yeah, I'm trying to send him a message. We lost him. Excuse me. In as much as I know that he's talking more about my area of, he's talking more about the area I'm also working in, substance use disorder and community readiness. I wouldn't want to take over his presentation, but I'm sure he's back now. So Dr. Tosin, you're back now. We're happy to have you back. So if you could go ahead and share your slides. Can you hear me, Dr. Tosin?
Okay, I can hear you. Let me.
Yes, please. You could just pull up your slides again. Yes.
Okay, so sorry about. So what's the impact? What's the impact of addiction treatment, particularly when we look at our communities? Now, when you compare with Western countries, you find out that studies tell us that it reduces substance-related consequences. However, the question is, does this happen in Nigeria? We all know the 4 pillars of the drug strategy: harm reduction, prevention, where you have the community partnership approach, the treatment and the enforcement. Now, community-based harm reduction programs have been successfully implemented in cities such as Geneva, Zurich, Frankfurt, Sydney. Dramatic reduction of drug users consuming on the streets, significant drop in overdose deaths, reduction in infection rates. This has worked in Asia, Americas, Europe. And that's why we're talking about Nigeria currently. And these are the 4 pillars of recovery: health, home, purpose, and the community. Now let's talk a little about community-based harm reduction. This is where we want to reduce morbidity, mortality associated with drug use. People who use drugs have a right to use in a safe manner. Social movement, affirming the dignity and rights of those who use. Then versus the moralistic, antagonistic, and punitive response. Then we look at community-based prevention. Now, I'm going to take a few minutes here. Mobilizing and engaging the community. A lot of what is going on now is to identify the community structures. Now, I've mentioned earlier that we have primarily about 4 different types of communities: the rural, the urban, the peri-urban, and the insecure neighborhoods or households or communities. So it's important to identify the structures within those communities. Mapping of the community is very critical. Now, in homogeneous communities, that's relatively easy. It's looking like everybody knows everybody. But in the more urbanized communities, most people sneak in and you don't know who is who. You don't know what is what. But there are structures within that community that can help us in identifying it. I'll give an example of a community that we're currently working in somewhere in the southern part of Kaduna State, or Kaduna North. All the crises, ethno, religious, whatever you want to name the crisis, none has ever touched this particular community. And when we asked why, simple. If you come in newly, it's an urban community. If you are coming in to rent a house, for example, all the landlords know that there is a process that we pass through. We don't ask anybody not to join us. However, there is some form of measure in place by the community to say, this is who we are, this is what we stand for, we want to know you, we want to know where you have come from, we want to know why you have come here. And if we all take our minds back, a lot of our traditional communities were like this in the past, until we got to the point where we stopped paying attention to new people walking into our communities. So in this community, all other communities surrounding them have had one crisis or the other. They are crisis free. And it's not because they have military, it's simply because they have social context in place that help checks and balances for whoever is coming into the community. So they can identify everybody, they know where everybody is coming from, and it's really a mixed race. Then, still talking about community-based prevention, creating awareness. Creating awareness, the fact that substance abuse is a disease, it's treatable, and treatment is available. Now, this is usually where the crux of the matter has been. We have posters, we have pamphlets, we have notices, we have media posts, we have radio jingles, and all of that. But every time you sit with people, there's still that part of them that says, we still think that it's not a disease. And as long as they see it that way, it affects the pathway to care. And I'll look at some of the things that we have done to help there. On the other side of this slide, school-based awareness programs. Now, a lot of these programs have been designed to target the schools, but they are not generic. They are context specific. because we now realize that some of the schools are private, some are public. And that means that the level of assimilation of information differs from school to school. So a lot of needs assessment to understand and a lot of contextualization had to go into designing those awareness programs. Some of our religious and faith-based organizations also have schools. And this had to be designed to also take this on board and take this into consideration. Then the youth groups, identifying role models, the women's self-help groups. A lot of our communities today, particularly because of issues relating to poverty, have a lot of self-help groups. And a lot of these mothers are really struggling under the weight of children, teenage children with substance use disorders. Now, the traditional belief at home is if the child is good, he belongs to the father. And if the child is bad, it belongs to the mother. So many of these women get blamed for all of this. Then there's also the engagement of local politicians, religious leaders, traditional healers, who are usually the first point of call. For anything in the community, they talk to the traditional healers. But we're doing a study with cancer recently, and we have to really talk to the traditional healers, because we found out that when patients come to the hospital after they've spoken to you, they go to the traditional healers, and whatever they tell them is gospel truth. They just believe it. Local government bodies, then tutelers, that's agents of change during festivals where drugs are used. So we have people there who are saying, well, I'm not using, and I'm also part of this festival. So you really don't have to. That's a gradual way of changing, particularly where it's accepted during festivals. Then people who provide jobs in the community, and then CBOs. Now, what are the things that can affect community-based or influence community-based treatment? Now, we have the influence of poverty, and we talk a lot about this in Africa. Now, being located in the community is a critical point, because then people are able to see and say, oh, this is what's happening, and they're able to relate to it. Community empowerment, mobilization of community resources. Then primarily a lot of our treatment settings are should be outpatient based, particularly where you have use of brief interventions. Now that goes a long way to help people in the community understand that, okay, he's coming back home. Okay, we see some improvement. Oh, okay, and that helps reinforce the belief that this can be treated. Continuum of care, integration in the community health and social services. Why do that? What's this designed to do? To help patients develop skills to manage drug and alcohol dependence in the community. Now, some of our communities, we also find that today, they're where they watch football, and in those viewing centers, you have a lot of drug-based behavior. So a lot of what we're trying to do, and most of the people who do this, do it because a lot of it is tied to poverty. It's a money-making scheme. So a lot of the awareness creation goes around this, and it's a lot of conversation with the structures within the communities to say, these are potential danger zones, you know, for people who are really struggling with a lot of this. And a lot of that communication is taking place with a lot of resistance from owners of these privately owned viewing centers who just believe, well, I'm just doing my business and that's it. Okay, so all of that is to stop and help reduce drugs. Now, the care pathway, and I go through this very quickly because I'm looking at the time up here. When we talk about care, we're talking about the complex intervention, you know, of mutual decision-making and organization care processes. In other words, the plan, the decisions, all that goes into how someone decides to access treatment, particularly for substance use. And I have this diagram up here, the existing options and the potential options. We have options for screening and referral at the community level. Do we have options for community confirmation of substance use and communication of diagnosis to affected persons? And then on the other end of that spectrum is the confirmation and treatment, treatment initiation, substance use treatment completed, ongoing management practice established within the community, accurate monitoring and quality control, follow-up of the client, accurate and verified substance use incident and treatment data at the community levels. Okay, and that's still the care pathway that we're using to have these conversations in these communities. Screening and referral at the community level. Teaching people at the community level about symptoms, what to look for. What are the things that you can aggregate together and say, this is what would constitute substance use disorder? What's the way forward? Stakeholder engagements, that's going on. And this has proven to improve sustainability of programs. Partnerships, community-based participatory approaches. The bottom-top approach, collaboration with traditional and cultural institutions. And I have this diagram here of the community-based participatory approach using, and this is in a nutshell now, a final summary of all that I'm talking about. Existing mechanisms for detection, referral, and treatment through stakeholder meetings. Collaborative action planning. Now that we know that this is a problem, now we are all sitting together in the same place and we're saying, what should we do? How do we go about it? We need your input. You need to be able to help us. We have come to learn from you. And that's one key thing about community-based participatory approach, the issues around positionality, you know, and allowing communities the position to decide for themselves how they really want to go about this. Then the implementation of co-implementation of intervention, process evaluation, and outcome evaluation. Thank you very much. I'll take questions now or comments.
Thank you, Dr. Tusi. That was quick, sharp, hot. You dropped it like hot potato. Thank you. I think Titi can just wait to ask a question. That's fine. Titi, please go ahead. Shoot.
Yeah, thank you so much, Doctor. This was very, very insightful, especially for, you know, those of us that are not in this space of research. This was, you know, giving even somebody that has not done anything on, you know, reduction of harm and all that. Once you listen to this, you can have like an overview of where you guys are coming from and what you're trying to do. But one of the questions I have, especially, I don't know if I missed it during your presentation, but I would like you to shed more light on what are those factors that lead, you know, in the Nigerian context, because this is where your work is, you know, focused on. What are those factors that lead people into substance use? Like, I know you mentioned poverty. If poverty is one of the factors, substances are quite expensive. So how these people that are affected and don't have money, how do they afford this? And what are those factors in communities that you see that are those things that, you know, lead more people into the use of substance? If you can just shed light on that area for me. Thank you.
Okay, thank you very much, Titi, for that question. No, you didn't miss it, because when I was going through this, I think I was more particular about culture and the pathway to care. So I mentioned poverty actually in passing. And you are very correct that a lot of these substances can be quite expensive. But let me join poverty with another thing that leads to the use of substances, and that is the influence of peers. Now, and I'll give you a quick example, and then I'll run through some of the other things that we see in our communities. Now, when I talk about the influence of peers, I'll give you a quick example. A few weeks ago, there was a youth program. And there was this young girl who had come from a highbrow family. And she found white substances, you know, in kept corners in the house. Apparently, she had an uncle who was using cocaine and she didn't know what it was. She was 13. And she just knew to sniff it. Now, she was sniffing it and she brought some to the program to help people who are feeling sad. Now, for those of us who work in mental health or developmental psychology, we know that usually during the teenage years, people struggle with mood changes that go with all the differences in hormones and the body and all of that. And she said to that, to a few people around, say, if you have a problem, you are feeling sad, I have something that can help you. Fortunately for the others, unfortunately for her, there was a talk around substance abuse, and she brought it to say, I don't know what this is, but I guess it's part of substance. It's a substance. And the person just put his finger on it and, you know, tasted it and found out that it was very good cocaine. That's one way that people get it. So they are poor, but those who have access are able to provide for some of them. Another thing that happens is marijuana is really cheap. I mean, it's available, it's there. There are different, they come in different potency. So as you complain that this thing is not hot enough anymore, somebody offers you. Another way they get it is by sharing. Now, we have parents who give to their children pocket money that is equal to what some of us, that is higher than the minimum wage in Nigeria. And suddenly they have access to all kinds of things. So for those children also, they're able to share with people who cannot afford. But things like alcohol, things like tobacco, they can afford. Then there is also the having to sell things, having to pick things, having to pilfer things at home. You know, so there's a lot of the social economy of what's going on in the house. Also, we're beginning to see that a difficulty in coping is also leading a lot more children into substances. Schools are closing later than they should now. There's a lot of work. You find children complaining about stress. Usually when I assess them with the stress scales, their stress is very high. You find parents saying, I don't understand why you should be stressed. You are not paying for light, you are not paying for water, you are not paying for fuel, you are not doing this, you are not doing that. All of that is tied to their perception. Then primarily is the availability, and that's the big thing about all of this. It's on the streets, it's everywhere, and it's no longer about money. It's about potency. So the lower ones are available on the streets, the house, and they will be able to buy it. So these are a lot of things that contribute to it. The family structures, the breakdown in family values, conflicts within the home, increased divorce rates. Then I come to the last one and then I will stop. And finally, it's our loss of the typical African cultural mindset. What's the typical African cultural mindset? That's the mindset of patience. That's the mindset of I'm happy with where I am, contentment. That's the mindset of, yeah, it's rough now, we'll get through it, we'll pass through it. Now I use these three because they're the exposure, and that's also another key thing. a lot of these children are now exposed to life outside Africa. They haven't been outside Africa physically, but they're exposed to life outside Africa. Music, movies, and all of this. And it's modeling the behavior of increased drug use. We're seeing a lot of that. I hope I have tried to answer your question.
Titi,
Yeah,
did we
very well.
try?
Yeah, thank you so
Okay.
much.
All right, thank you. Two more questions, and we'll just run to the last session with Oluwo. But one question from Olivia. I'm sorry, I just hope I'm pronouncing your name well with my beautiful Nigerian accent. Her question is, with economic development and the growing uber-rich population in Nigeria, are drugs a part of the social culture of the subgroups? Did I get that right, Olivia?
Yes, because I've noticed like the change in movies culture within Nigeria. Like you see a lot of really rich families, and it's portrayed that like the youngsters have high access to drugs, and it's kind of like a common thing. So I don't know if like the media is portraying real life or what is happening.
Oh, yes, you are very correct. And that was the last point that I was making about the influence of the media, the influence of music. So what you are watching, I think a lot of times when we watch movies, we tend to feel it's a movie, it's a fiction of somebody's imagination. Somebody just wrote up a story. But many times the stories are written, and okay, maybe more of the Western movies, you find at the end, this is fictional. The characters here are fictional. We are not portraying anything. But trust me, the increase in socioeconomy, the increase in access to the Western world are all playing a role in a shift in culture, so that a lot of this is tied to why we are seeing a rise in the use of drugs. So yeah, they are portraying it, but they're not just portraying it. I would refer to a terminology in psychology that is known as vicarious learning. So they are portraying it, people are watching, and people are going through it. I'll give you an example that is not drug related, but it's also a good example. So between Kaduna and Abuja is a highway. It's a dual carriageway for those who have never been to Nigeria before, and it connects. Kaduna used to be the capital of the north. Abuja is the current capital of the nation. So there's a lot of traffic along that road. And suddenly there was an increase in banditry and kidnapping on that road. Because in practice, I was seeing a lot of, when people were released after kidnapping and they described their ordeal, it was like a movie that I had watched. So I began to ask questions about what they noticed around them. And yours truly, these guys actually watch a lot of these movies. So a lot of people moved from the road to travel by train, particularly when the train came. And I remember saying to people that I used to love Westerns when I was much younger. And I said, well, those guys had a way of robbing trains. They can do this. And you know, just early last year, they did it. You know, and they did it, it was coordinated, it was well done. And a lot of this we have said, I've had opportunities to talk to some movie producers to say to them, what you're doing to our society, you are not correcting the ills of the society. You are giving them more information about how to do this thing better. You know, and he said, well, some people may take that part, but we are also trying to correct. And because we are not science-based, we are not saying, okay, well, we have done this study. Has this actually helped people learn, or is it increasing the rates of the use of drugs amongst this group of people? You know, so I agree that it's increasing it, and people are learning from it, and it's actually portraying what's going on around us.
Yeah, thank you so much, Dr. Tosin. One more question from Pascalia, then I have one question, and we could just wrap up the session and go to the next, the last session. Pascalia, you had your hand raised. You still have your question? Yes, please.
Yes, mine is really not a question. I just want to make a comment, and I'm really attracted by what Dr. talked about community engagement, which I totally agree, because most of the time, the area that we really miss in terms of community engagement is the question of the community centers of power. And those centers of power are not very apparent. We have this habit of saying community engagement because we just call people to come and sit. But if we don't engage the centers of power of the community, in other words, what the thing, people, areas that are significant to them. For example, their own knowledge system is a community power, social dynamics, environment, culture, time, even symbols, or those people, the significant others in case of this drug abuse. So most of the time we miss that component. And so when we miss that component, engaging the centers of power of the community, whatever those centers are, we find ourselves solving problems that are ours, not the communities, or in a way we know, not the way the community knows. So we put in a lot of resources, and at the end of the day, we miss everything and nothing changes, because we miss to notice what are these centers of power of the community, because those are the things that can power them to act, to be agents, to be agencies to this problem. That is what I wanted to add. Thank you very much, Dr. Powerful.
Thank you so much, Pascalia. It really feels good and really feels hopeful for me to hear the strong voices from motherland, from Nigeria, from Kenya, from Africa. I really feel there is hope, and I feel that it's always that, there remains a pathway that has not been explored to achieving success in all our implementation. A quick question from me, Dr. Tosin. I recently concluded and defended my thesis in May, and my study population was from Ondo State in Nigeria. I think I shared with you. And one of my findings was what you mentioned this morning, that the first care-seeking point for people with substance use disorder is to the traditional healers. Now, the traditional healers has, from time immemorial, a long time before civilization, when the core Africa was core Africa, the practice of our tradition, the Ifa, the Oshun, the Orumila, the Obatala, all of it that I know, the Igbo deities and the Hausa deities, which you know more than I do, I realized that the first point of call for most of these people, especially in Nigeria, is to seek help from the traditional healers. And from experience as well, and I usually say this, I worked to Save the Children International for a couple of years, and I realized that when we're having an increase in neonatal deaths, we have to trace it to the fact that women were going to traditional birth attendants for delivery of their children. And such, they had some practices, which were good and which has been of old. However, some of the instruments of cutting during delivery were not sterilized, and the children and the mothers were being infected during during delivery. And as such, we had to collaborate with these traditional birth attendants and provided them chlorhexidine, safe cutting tools and all that for delivery. Now, could you just shed some light into your experience with how the partnership has been and how the referral system has also been, because we know that our belief is that when someone is having some mental challenges, some mind illnesses, we believe that they have to consult the spiritual, the supreme, to know exactly what the issues are. And that belief has not changed and is not going anywhere. Now, we know that to a large extent, most of our traditional healers as well have been able to help a lot in this regard. And some people usually don't have a need for referral, you know. Now, so what has been that partnership? What have been the successes? What have been the challenges? And what have been the referral system for people that need further evaluation and care and treatment? So that's my question.
Okay, thank you very much, Loretta. And I'm going to marry your question with Pascalia's last comment. And in the past, when about 2002, when I started community work, just like she said, we will go into the community with our own ideas, with our own conceptualization, having read all the books, we ram it down their throat, go through all the communities through the night, we come out and we say, yes, we have done community engagement. Then a few months later, after the intervention, we go back and check the data, it's not working. So we had to come back and sit down and say to ourselves, we are going in there with a mind that we know everything. We need to go in with the mind of we know nothing because we are not a part of that community. So we have come to learn. And here is where the problem is. The typical African who sees you drive a white Jeep with blue plate number believes that your own blood is blue despite the fact that your skin is black. So when you come to say, I've come to learn from you, they say, oh, that's good. And they're waiting and looking at you. Then you say, so what do you think about this? They say, we don't know. Whatever you say is correct. They know. But the typical African mindset is, okay, let me narrow it down home. The typical Yoruba mindset, and I think this goes for many African communities, is that the senior man is always correct. So you hear things in Yoruba like Agbalagba Okin Paro. In other words, the elderly person does not lie. So even if he's lying korokoro, you will know that you will just tell yourself in your mind, he's not lying. He's probably seeing it from where I am not seeing it. So that issue of power and positionality became a challenge. And in that study, we had colleagues from Liverpool. They simply couldn't understand, first of all, how we as researchers could not take on power to move. By the time we got out of our mental rut, R-U-T, we went to the communities and it took time. In fact, when they were saying, this community engagement activity is taking too long, we had to say to them, they are not telling us what is there deep down yet. Now, coming to community, now, Loretta, coming to your question around traditional healers. When I first started 27 years ago, if you came and said you came from a traditional healer, we condemned you. Here's what we found out. The patients just sit in front of you. They listen to everything you have to say. You write your prescription. They go to the pharmacy. Some who end up in the pharmacy, some take the prescription, they don't go to the pharmacy, they disappear. Others go to the pharmacy, they collect the medicines, they never use them. They come back for follow-up if ever they come back. They go back to the communities and the traditional healers tell them, don't mind those hospital people. They don't know what they are doing. Are you trying to say that one tiny white tablet will drive away evil spirits? Evil spirits are very powerful. Tablet does not drive them away. So we knew that there was a problem with the understanding of mental illness. And here's what we did. So we had to now go to where they are and begin to sit with them and try to understand what they do and how they do it. Initially, there was this suspiciousness of the hospital people have come. They want to use this thing so that they will tell our community members not to come to the hospital. But we have to do a lot of talking, a lot of engagement, a lot of understanding, a lot of listening to be able to build trust, build confidence, and for them to now see us as partners. Now, I use the word partnership strongly because we found out that they had some measure of success. And where we were not having success, they were able to do it. So we said to ourselves, this is very simple. What's our goal? That we have a healthier community. Now we can sit together with these people and begin to earmark where we come in and where they come in. And in a few of the communities that we worked that model in Kaduna State, we found out. In fact, something interesting happened. I'm a Christian, but I had to go talk to some of the Islamic scholars to learn from them. Now, that was a mindset change for me. Ordinarily, I would not do that. But you know, we came to an understanding that we need to help these guys. Now, long story short, we have come to a point today where people get referred from traditional healers to the hospital. And they come telling us the details of what has happened there. One thing we were able also to do was to provide education, and the education went both ways. We educating them and them educating us. Okay, this issue of flogging, you don't need to flog. The reason why he's doing this is the reason. Then we found out, of course, I forgot to mention, we found out something. We also found that sometimes the patients were coming into the hospital with what we call extrapyramidal side effects, which meant they were taking some antipsychotics inside some of the water that they were drinking. So by the time we started engaging with them, we were able to say, look, you're already beginning to do some of these things, but you don't understand measures. So why don't you do this side? We do this side. The most important thing is that the patient gets well. So today we find them doing a lot of referral. And the fact that they are now referring and saying, those guys get up and actually come to the hospital. Whatever you tell them is now gospel truth. Why? The traditional healer had said, go, then come back, and we continue with my own side. That partnership has really moved things forward. We're seeing more cases. They are also recording more successes. We're having conferences together. In fact, the students had a program in Zaria recently, and they invited some traditional healers, to also come and talk about substance abuse. So we're co-creating, co-creating awareness, co-creating interventions, and all of that. And it's something that I think we need to upscale around, all our communities, because it's really the way to go.
Thank you so much, Dr. Tosin. That was very, very clear and detailed. And I just want to say it here that currently three Nigerian students, myself, Titi, and Jumai at the National Louis University in the Community Psychology Program, three of us are focusing on one thing, and to say whatever implementation, Titi is working on domestic violence, Jumai is working on female genital mutilation, I'm working on substance use disorder, and we're saying one thing, we're saying whatever intervention is coming to Africa, must definitely go through the traditional institution. You cannot walk past the traditional institution. You cannot walk past through the traditional healers because they are the first point of care seeking in Africa. And that's not going to change. It's not going anywhere. And when we're saying partnership and collaboration, that is where it will start from because they are the custodian of our cultures, our values. So thank you very much for tying all together. We're really, really grateful. And having said that, we're going to go to our last and final session, but I would want Dr. Moshood to please introduce our next speaker. Dr. Moshood, are you here? Dr. Moshood, are you anywhere here?
I'm sorry, he had to step away, so he'll be back in 1 minute.
Okay, because I would really like him to introduce Oluwo Fakayode Ogunlano, because I think that's the pathway. I'm an African woman, an African girl, and I think he should do the honors of introducing him. But if he's not here.
Yeah, go. Maybe he could introduce himself, but so I apologize about that. But he just had to step out really fast.
Okay, thank you, Dr. Brad. Oluwo Fakayode, with all due respect and with honor and dignity to you, sir, with all due respect, will you please go ahead, take the floor, and start your presentation? I do not know how best to introduce you. Dr. Moshood would have been the best person to do that, so please forgive me. But with all honor, with all African greetings, Ekason, Ekaro, Ekale, Bubuyin Lakiton, I want to hand over to you, sir. Thank you.
Thank you so much, Loretta. This is perfect. So thank you. And hello, everyone. It's an honor to be here with you all. I would like to say thank you to the presenters, Pascalia and Dr. Tosin, for their presentations. My name is Oluwo Ifakayode Ogunlana, Kyle Joseph Johnson. I'm native to the United States. I am a practitioner of the Ifa tradition, and I'm here today representing the Ifa Foundation. I've been a practitioner of Ifa since the year 2008, and became initiated into the path in 2010. And this has been a passion in my life, understanding the connection between indigenous African traditions and our psychological well-being, our psychological health. This was something that actually helped to transform my life. So I really loved the presentations that were given, starting with Pascalia about the importance of living indigenous knowledge. Because this was my starting point. This was my origin. Everything that was given in her presentation was what prompted me to embrace African traditions, to begin to study and practice African traditional religion. I love very much how the two presentations complement one another. That of Pascalia of living indigenous knowledge, and that of Dr. Tosin on care-seeking pathways amongst people with substance abuse disorders. Because they're very much tied. I feel that the more we live indigenous knowledge, the more we find solutions to the challenges we face with our mental health, which guide us, which move us towards substance abuse. And I can relate because this was my story. This was my experience at a time in my life when I struggled with substance abuse, looking for a way out, looking for a way to heal the traumas, and not even looking for a way to heal, looking for a way to cope, looking for a way to even escape what I was feeling, not knowing how to transform the quality of my experience, not knowing how to refine what I was experiencing internally, emotionally, mentally. It led to habits, it led to tendencies, it led to patterns in my life that were unproductive, that were self-destructive, that did nothing to help me connect with the very essence of my being that I discovered through embracing traditional African religion, which became, you can say, the main ingredient towards my personal healing, towards my personal transformation. So I would like to say thank you to the presentations, to the presenters that were given for the presentations they gave, because it really hit home. It really took me back to my root. It took me back to my origin, which is very significant for this presentation, for this panel, because the topic of our session today, you can say the title of this meeting given by Moshu was Isheshe, spotlighting African community practices. So in my presentation today, I want to give a discussion about Isheshe. What is Isheshe? What is the relevance of Isheshe to our life? How is Isheshe connected to the presentation given by Pascalia on living indigenous knowledge? How Isheshe is tied to, you can say, it becomes a solution to substance abuse disorders. So we'll start with that. We'll start with what is Isheshe. In this presentation, you'll see that Isheshe is relevant to each and every one of us, regardless of our belief systems, regardless of what tradition we practice, regardless of our position in life, regardless of our culture, regardless of all the apparent differences that we see amongst one another, the different paths we've chosen in life that make us different, that make us unique. Isheshe is as irrelevant for me as it is for you, as it is for everyone else. So I want to show what Isheshe is. We'll break down the word Isheshe. We'll see how it applies to our life. We'll see that there is a personal level of Isheshe that is relevant for each and every one of us, that is unique to each and every one of us, that's important to look at, that's important to embrace. But there's also a collective Isheshe. There is a universal Isheshe. And we'll see how all this ties together and adds to the importance, the notion that was given regarding the importance of living indigenous knowledge and how that can actually become a solution towards substance abuse disorders. So what is Isheshe? Isheshe is a contraction, and I apologize in advance, I do not speak Yoruba language fluently, so I give respect to the Yoruba here, to the Nigerian natives here. And I'm grateful to be able to speak on behalf of the tradition, of your culture, of your homeland, because it is a beautiful tradition. The word Isheshe is a contraction of two words, Ishe, Ishe, which means source, root, or origin, and then the word Ishe, practice or tradition. So Isheshe is the source of traditional practices, the origin of traditional practices, the origin of all that we know in the form of traditional practice. This word Isheshe is letting us know that everything has an origin, everything has a root, everything has its source. And this source, you can say, is tied to our traditional practices. All traditions, all cultures are rooted in a single source. Everything about our lives, everything that we are individually has a source. Everything that exists within the universe itself, that exists within creation, that we exist, anything existing that makes up what we call reality has a source, has an origin. And this is Isheshe. So we want to see the implications of embracing that understanding, of even connecting with that source, to see the implications that that has towards our personal healing, towards our personal transformation. So as a representative of the Ifa tradition, I'm going to use a couple of verses from Odu Ifa, from the text, the sacred text, which was once, was oral tradition, but we have now much information written down about the verses of the Odu. I'll present two different verses of Odu Ifa that speak about Isheshe. One is speaking about it directly. It tells us what Isheshe is. And this is to be the first verse that we start with. The second verse is speaking about Isheshe indirectly. If we have the proper context, if we have the eyes to see it, we see that it is also talking about Isheshe. So let's see what the tradition says about Isheshe. I'll go ahead and share on my screen so you can see it. And if I can just get, please get a thumbs up if you're able to see the text there. Okay, beautiful. So this first verse from Odu Ifa is coming from the Odu Ogunda Owana. And the text states, the ocean in great expanse, the lagoon also in great expanse, the leader of all rituals of the earth. Isheshe is the progenitor that brings one to the earth from the beginning. The reason why our forefathers take very good care of their women. They would address her issue from the scratch of her life. Because one's father is one's Isheshe. One's mother is also one's Isheshe. They did not abandon Isheshe. Their lives were better. The Babalawo of Ishan in heaven cast divination for Isheshe, our root and the leader of all rituals on earth. Also cast divination for Isheshe, the leader of all rituals in heaven. One's father is one's Isheshe. One's mother is also one's Isheshe. One's Ori, one's soul, is one's Isheshe. One's Ikin is one's Isheshe. It is the Isheshe one would first sacrifice to before sacrificing to Osa. So this verse from Ifa is letting us know what Isheshe is. It says that one's father is one's Isheshe, one's mother is one's Isheshe. So this is already directing our attention towards ourselves. It's directing our attention towards our culture. Isheshe means the source or origin of traditional practices. And if we look at it from this perspective, this is talking about if we consider our mother and our father, the ones that we are descendants of being our Isheshe. This is pointing towards the origin of everything we are at the biological level. We inherit certain genes from our ancestral lineage. We are a product of our mother and father. Everything that we are, you can say, the traits that we have at the psychological level, mentally, emotionally, our tendencies, our predispositions, are rooted in where we come from, are rooted in who we come from. So one of a big factor in our personal development and our personal healing is embracing who we are, is turning our attention to where we come from, our roots, our origin. Our mother and father gave birth to us. Our mother and father, our mothers and fathers are a product of their mothers and fathers, are a product of their mothers and fathers. So we're tied to our ancestral lineage. So this is about us embracing and not abandoning our ancestral Isheshe. And for each and every one of us, this is different. We all have, unless we're siblings here, have different mothers, different fathers, different family lineages. And it's important for us to embrace that. It's important for us not to abandon that, not to turn our attention away from that. Because in that Isheshe, that's tied to our mother and father, that's tied to our ancestral line, we discover a lot about ourselves. We discover all the greatness that we are. We discover all the strengths that we have. We discover all the traits that we embody that help to enrich our life, that allow us to make an impact on the world. We discover everything that's meant to be carried on in the future. We discover that which is meant to be passed on to future generations, the beauty, the power, the strength of our ancestral lineage, of our Isheshe. But we also discover our weaknesses. We also discover our limitations. And we must not abandon these things. We must turn our attention to these things. We must transform these things. We must refine these things. There could be patterns, self-destructive patterns, limiting patterns that we find in our ancestral lineage, that unless we bring our attention to, unless we face, unless we see with open eyes, unless we embrace with an open heart, there's no way to transform. There's no way to change. There's no way to shift. We would end up perpetuating those genetic weaknesses. We'd end up perpetuating those psycho-emotional tendencies that don't serve us, that stand in the way of our life. So it's important to turn our attention to become aware of our personal Isheshe. What is our origin? Where do we come from? Who do we come from? A lot of the answers, or you could say the doorway to our personal healing, to our personal transformation, starts there. We embrace our family lineage, the beauty, the pain, the strengths, the weaknesses. That lets us know how we start. That lets us know what we have to do in our life. That lets us know what we're here to become in this life, what we're here to overcome in this life. If we go a little bit further back, we discover our ancestral lineage, our ancestral line, our heritage. And for me personally, this was one of the key factors in my life. This was a contributing factor to my personal healing, my personal growth in life, was turning towards my personal Isheshe, embracing my heritage. This led me at a young age, at 17, learning about my culture. I'm Cape Verdean descent on my mother's side. I have ties to West Africa. This opened my eyes, this opened my mind to embracing my African heritage. And that played a key factor in my healing, a key factor in my growth. At the time in my life when I was abandoning, you can say that aspect, when I was unaware, I was ignorant of my heritage, my cultural connections, the cultural influences that I had. I was in an imbalanced state. But once I began to embrace that, I started to rediscover a part of myself that was lost. I started to connect back, you can say, with that source, that origin, that brought a lot of answers to my life. So this verse is letting us know our mothers, our fathers are our Isheshe, that we should not abandon Isheshe. We should turn our attention towards it. And you can say at the closest level, the most easiest level, you can say at the most human level, Isheshe is talking about our family line, where we come from at the biological level. our ancestral lineage, our culture, our cultural traditions. So this verse is encouraging us that this is where we start. We should sacrifice to Isheshe first. This is where we should bring our attention. This is the beginning point of our journey, embracing this part of ourselves. So we can all look at this and say, what is my personal Isheshe? Where do I come from? Who do I come from? And what does that imply? What does that say about you? What does that say about your life? How has your personal Isheshe contributed to who you are today? Whether it be in a positive sense or a negative sense. What traits have you inherited from your ancestral lineage? What traits were passed down to you by your parents that helped make you who you are today, that helped shape the positive aspects of your consciousness? And what traits may exist from your Isheshe, from your ancestral line, that don't serve you? What patterns are you meant to break? What aspects are you meant to transform? So these are questions that we can ask ourselves. When we embrace our Isheshe that comes from our mother and father, we oftentimes are opening up to our personal traumas. We're opening up to our shadow side. We're opening up to aspects that we may not want to see or face, that we may have spent most of our life running from. And this is where substance abuse comes in. We're running towards something. We're using substances to avoid, to escape the reality of what's present. So we want to be as aware as we can about who we are at this level. Who we are at this level of our Isheshe. So much can come just from this level of us looking at who we are in connection to our family, who we are a product of. This can be at a family level, but it can also be our environment. Where did we come from? What environment did we grow up in? This was our origin. We are all here today as adults, but how our life may have looked when we were children may not be the same as it was today. So that is also Isheshe, our origin, where we come from. So we want to take all this into perspective and embrace this as a part of our Isheshe. Our environment where we come from, the influence of our family, the influence of our parents, the influence of our ancestral line, the traits that were passed down by our ancestors. We take all this into consideration. We should not abandon these things. So this is Isheshe, you can say, at the personal level. But Isheshe is also at a bigger level, a universal level. Even if we look at it from a spiritual standpoint, a metaphysical standpoint, Isheshe is relevant. So let's see it now at the level of, you can say, the universal level that speaks about Isheshe within the context of tradition, the importance of embracing our indigenous traditions, of not losing these indigenous traditions, and see what is the source, what is the origin of our traditional practices? Where do they come from? Where does the Ifa tradition come from? What inspired it? So this is a verse from the Odu Okanran Obara, which says, Agogo Sekete, the priest of Aloba's household, cast divination for Aloba in the beginning. He was asked to perform sacrifice such that his ancestral monument would not die. How would this monument not die? He was asked to perform sacrifice. They told him that when one becomes old and aged, he would ascend to meet his forefathers. It is to the same fathers that was known in the beginning that one would return. Without going to this familiar environment, he would be sent back. He was asked to perform sacrifice. He should observe the practice of his fathers that was known ever since creation. Masquerades belong to Aloba's household. All the deities belong to Aloba's household. All progenitors are worshipped in Aloba's house. They advised him not to allow the practice to die. They performed the sacrifice. Their things became successful. Life pleased them. He then was dancing and rejoicing. He was praising his Babalawo. His Babalawo was praising Ifa. He said it was exactly as his Babalawo had said. Agogo Sekete, the priest of Aloba's household, cast divination for Aloba in the beginning. He was warned to perform sacrifice. He was asked to perform sacrifice such that his ancestral monument would not die. They all heard about the sacrifice and performed it. Please do not let it die. The masquerade in Aloba's household, please do not let it die. Everything of ancestral importance in Aloba's household, please do not let it die. The Odu Okanran Obara. This is a very powerful Odu. It's calling for us to embrace our Isheshe, to perform sacrifice, to make the necessary changes in our perspective, in our actions, in how we move through life, such that our ancestral monument does not die. He was told that when he became old and aged, he would ascend to meet his fathers. It is to the same fathers that was known in the beginning that one would return. This Odu is talking about the very origin, the very source of traditional practices. It speaks about a practice that was known ever since creation, that was known ever since the beginning, ever since the origin of everything that exists. Everything has its source. Everything can be traced back to this source. So this is very, very profound. It's encouraging us to embrace the very essence of spiritual traditions, to understand that every traditional practice, such as Ifa or any other indigenous system, has its origin in a universal knowledge, has its origin in a primordial tradition, has its origin in a knowledge that precedes creation itself. It says that all progenitors, all the deities, all the masquerades belong to Aloba's household. When it says all the deities belong to the house of Aloba, this is not just talking about the Yoruba deities. This is talking about any aspect of creation, any aspect of the supreme consciousness, any aspect of God, any divine aspect. All have their source in the house of Aloba. All have their source in this knowledge that was known since creation. All have their source. All systems have their source in the primordial or universal spiritual tradition. This verse is encouraging us to return back to that. This is Isheshe. Isheshe is the source or origin of all traditional practices. So we're encouraged to embrace something that is universal, that transcends our personality, that transcends all cultures, that transcends all traditions. Everything points in the direction of the universal knowledge. Everything points in the direction towards the supreme absolute. Knowing something that was known ever since creation. This is not just talking about a spiritual tradition. This is also talking about that which exists before creation itself. That which exists as the very origin of creation itself. And with this, we are talking about the supreme consciousness, which the Yoruba call Olodumare. Olodumare, the one whom I must return. Olodumare, the supreme one. The king of the beginning and the end, the king of what is before and behind, the king of today, tomorrow, and forever. Everything has its origin in the supreme consciousness, in Olodumare. And that is our Isheshe. So we're meant to rediscover that. We're meant to connect back with that. We're meant to live our life in a way where that understanding and that connection is not compromised. And from my experience in life personally, and from my experience as a practitioner of the Ifa tradition, I believe that a lot of the challenges that we face in our lives, psychologically, are a result of losing contact with our Isheshe, are a result of losing contact with this source, with the very origin of everything that we are. So at a personal level, this is pointing towards the very essence of our own being. There's so much more to who we are than what we see when we look into the mirror. There's so much more to who we are beyond our personalities, beyond our history, beyond our stories. There's so much more to who we are beyond our mind, beyond our self-concept, our sense of self. And this is an encouragement to reconnect with that. This is the very origin, this is the very foundation of everything that we are. And to live our life without having a connection with this aspect of ourselves means that we don't have a center. It means that we don't have a foundation. It means we lack the proper context to understand our existence, the context to understand our life, the context to understand whatever it is we may be experiencing from moment to moment. The Yoruba have this concept of the human being that's called the fourfold nature of Eniyan, the fourfold nature of a human being. It deals with what does it mean to be human? What does it mean to be who we are? It teaches that we are much more than our physical body. It teaches that we are much more than our mind. It teaches us that there is a quality of being that is beyond, and at the same time, at the very center, the very essence of everything that we are, at every level of our being. And this is Isheshe. Everything that we are at the level of our soul, at the level of our Ori, which the Yoruba call it, everything that we are at the level of our manifested being, at the level of our mind, at the level of our emotions, at the level of our physical body, has its origin in something. It's a product of something. It's emerging from something. It's sustained by something. That something is not a thing. It's a lack of words here, but a certain quality of existence that is beyond and permeates everything that we are. And that is our Isheshe. And through living indigenous knowledge, we are encouraged to rediscover that. We are discouraged to connect with that, to make that the very foundation of our experience in the world, the very foundation of our human experience. When we connect with this part of ourselves, we are sustained. When we make contact with this part of ourselves, we are enriched. We have the resources, the inner resources that we need, that prevents us from falling into substance abuse. We come into contact with something that is far more expansive, far more powerful, far more beautiful than anything else we could indulge in within creation itself. Nothing can touch this quality of our consciousness, which is the very source of our being, which the Yoruba call the Ipan-Ri, which has a certain correspondence with the supreme consciousness, Olodumare. It shares the same nature as Olodumare. So just like everything within creation has its source in the supreme consciousness, emanates from the supreme consciousness, is sustained by the supreme consciousness in the universe itself, and will eventually return to that universal source. Within ourselves as human beings, we are created in the same way. We are a miniature universe. We reflect the nature of the universe itself. Exactly how the universe is structured is how we are built. So just as everything in creation has its source in the supreme consciousness, everything that we are at every level of our being, at the level of our soul, at the level of our mind, our emotions, our physical body, has its origin in what the Yoruba call the Ipan-Ri, the higher self. And that is our true source of healing. So Isheshe is important because Isheshe is an invitation to reconnect back with that quality of our consciousness that precedes everything, that is the ultimate destination of everything, and that is the very essence of everything. Everything that we experience in our life exists for us to reconnect with that, to discover that quality of consciousness within ourselves. Everything in our life exists to take us back to Isheshe, to take us back to that source, that origin of everything that we are. But when we don't know that, or when we don't have the methodology, we don't have the vehicle to utilize that knowledge that takes us there, we can fall into substance abuse. We can fall into depression. We can fall into impatience. We can fall into this feeling that we always need something else to feel okay about ourselves. We can fall into this way of living that is individualistic, that is about competition, rather than communalism, rather than being connected to one another, seeing the connectivity, seeing how our personal life, our decisions affects everyone else's. When we do connect with this aspect of ourselves, we align with the concepts that Dr. Tosin talked about, which are reflective of African culture, traditional values, patience, contentment, communalism. When we get to know this aspect of ourselves that Isheshe invites us towards, we discover that essence of consciousness that is within every other person. It exists equally in me as it does in you, as it does in everyone around you. When we are able, through our indigenous practices, and this is the source, this is the reason, the purpose of indigenous practices. When we're able to connect with this aspect of our consciousness through our indigenous knowledge, it leads to a more harmonious relationship with other people. It leads to a more harmonious relationship with our environment. It leads to a harmonious relationship with every dimension of the human experience. So this is why Isheshe is important. This is why embracing indigenous knowledge is important. Going back to Priscalia's presentation, living indigenous knowledge provides an identity and historical perspective. It connects us with that personal Isheshe. It connects us with our ancestral Isheshe. The aspect of Isheshe that we inherit from our parents. It connects us to all people, to the land, and to its natural resources. As we align ourselves with that dimension of being that is at the very center of everything that exists, how could we live in opposition to the land? How could we live out of harmony with Mother Earth, with the people that make up the earth, with the resources that exist within the earth? If we were able to perceive all of that as an aspect of ourselves. Embracing indigenous knowledge guides people in all areas of life. We learn, we see the connection between every dimension of our life, our personal life, our family life, the relationships we choose, the relationship we have with certain things in life, our career. That essence of consciousness permeates every dimension of our life. And every dimension of life becomes used as a vehicle to rediscover, to connect back, to strengthen our relationship with that source, with the very essence of our being, as opposed to being things that we do in life that take us further away from that, that make us become more oblivious to that sever our connection with that quality of consciousness. Living indigenous practices provides a sense of relevance and self-esteem. How can we not feel relevant? How can we not have good self-esteem if we're aligned with the very essence of our being? If we're able to embrace in totality the power that we have within us? How are we not able to feel good about ourselves? How are we able to not feel relevant? By connecting with our source, with our Isheshe, we see exactly how relevant we are. We see exactly how we provide a very unique contribution to the whole. So this is the value of Isheshe. This is the value of embracing indigenous knowledge. This is the value of not allowing our ancestral monument to die. And I feel this becomes the antidote. This becomes the solution to many of the challenges we face psychologically as a people. Priscalia talked about the influence of colonialism, the influence of, religious influences on the indigenous systems and traditions within the African continent. How could we, if we had an understanding of Isheshe, if we understood that all traditions are rooted in the same origin, that all traditions emerge from the same universal tradition, then how could we ever be at war? How could we ever try to destroy someone's traditional practice, which is a unique expression of that primordial tradition? You see, the traditions that are being imposed on the African continent are just as valid as spiritual paths as Ifa, for example. However, the mere fact that they're being imposed on the African continent and being used as means to destroy the indigenous systems of Africa is a testimony to the fact that these practitioners of these traditions are not connecting with the essence of the path. Those traditions for them are not used as a vehicle towards discovering Isheshe. You see, so in essence, they're just as valid as any indigenous system. But the way in which they're practiced doesn't really serve its true purpose, because any tradition that allows us to discover its universal source becomes a path towards connection, connecting with everyone, allows us to embrace other people for how unique they are, for what they bring to the table. We can see the commonalities amongst each other, amongst traditions, rather than seeing the differences. So this is the value of embracing Isheshe. And this is, you can say, this is the very, at least from my personal experience, this is the purpose of African spiritual traditions. This is what embracing the Ifa tradition did for me. I was born, for example, Catholic. I knew nothing about African traditions. I knew nothing about my history being tied to West Africa. I knew nothing about this. I was a young man in college looking for answers. So I embraced, I became, my major became Africana Studies. I became an Africana Studies major. And it was through that I started to learn about indigenous African traditions. It was through that I started to, which is a part of my personal Isheshe, because it was embracing a certain dimension of my ancestral heritage. If we follow these paths correctly, it's leading to a deeper sense of connection with everyone around us. It's leading to a deeper sense of appreciation of what exists around us. It's leading to a different relationship with our life, with the challenges we face in life. So this is what I wanted to share about Isheshe. I hope it made sense, and I hope it was meaningful, that we're able to gain some meaning from it, and to use this presentation, this discussion as an invitation to go deeper within yourself, to connect with your Isheshe, to connect with your personal Isheshe. Use that as an invitation to discover the universal Isheshe.
Thank you, Oluokao. That was beautiful, excellent as usual. And I will apologize to everyone. I'm at an APA convention in Washington, D.C., so I stepped out a little bit. But I'm back here now, and I know people will probably want to ask questions before we get out of here, but I was supposed to give a contest earlier, but because I had another presentation, my mind was jumping all over the place. This was almost very strategic when we talk about the Isheshe. When I put it on the contest, that's what we're going to talk about, is I've been given this opportunity, this big opportunity to go about different part of the world for this society to sort of reclaim, sort of make them visible. So what I do is mostly around epistemic justice. Some of what we've lost in terms of languages, in terms of rights, in terms of way of life, you know, as a way of a funny story, my great forefather used to say, oh, you know what? Oh, they had so much power that he was a war general. Something like he can stay in this room and dispatch his soldiers, and after 4 months, he's going to meet them at the war front, you know. And people will be like, what is that? How can you do that? How can you travel like, you know? But what he's saying to me is, you know what? We had so much agencies back then that I can speak to the leaves of the trees and they'll do my bid. They understand what I'm saying. I understand what they're saying. I don't think we have so much of that anymore in terms of over pollution of, you know, the injustice that has taken place over many of these things. So it's not easy to reclaim them. And so when we post this Isheshe as a way to go, especially for us as an African, it was very strategic to say, well, we want to start this discussion here because we're academic people, we're scholarship people, and we're always, you know, trying to create this ultra reality without grounding ourselves in this what we think Isheshe is, you know. So it was a good way to start this African region series with Isheshe carefully. And I see everything I've heard Oluoka talk about essentially is that I missed part of the 2 other section, but I know it was beautiful. I can imagine people have questions, so I'll probably be full back now, let people ask questions before we get out of here. I think we pass time already, Loretta? Or we're still good with time?
We're still within time.
Oh, okay. So,
and I was also hoping we're having a bit of Oluwo helping going through some meditation session. Is that still happening?
I mean, that's up to Oluwo. Maybe it's going to help us end the section with that. We can all go with that blessing if you so feel inclined to. But there's a question lingering in my mind, you know, because when we talk about the coalition between mixing our academic space with IFA Foundation, for instance, with the, say, sort of the Christian faith or Islamic faith, and when we talk about sacrifice, particularly when we call it Ebo, people get scared, people run away, people feel like they shouldn't be mixing together. Whereas every food you eat is a sacrifice. What we are doing right now is sacrificing time. I think there's need to explain this to people better, put it in a context of this is part of the practice of Isheshe. Like every time you send food down, you're worshiping something. And, you know, you're giving grace to all of this entity that make up that. Is there any way you can help us explain that more so than now, that people need to know that we're all sort of sacrificing something every time we give up all of this time to do this work?
Yes, most certainly. Yes, it's as you said, Moshood. The 2 verses that I presented talked about sacrifice, but sacrifice here is as he said, it's the choices that we make, it's the actions that we perform. This sacrificing, for example, so that our ancestral monument does not die, so that we don't abandon our Isheshe, the practices of our forefathers, of those who come before us. This is about the choices that we have to make to either embrace certain things, to walk towards certain things, to open our mind, our hearts towards certain things that we may not have been aware of. It's also about letting go of certain things. In order for us to embrace our Isheshe, to embrace our ancestral monument, there's a lot of beliefs that we have to let go of. There's a lot of sacrifices that we have to make. There may be some changes to our lives that we need to make because we may be living in a way that is out of alignment with the traditions of our ancestors, with the values of our family system. And the choice to say that I'm no longer going to engage in this habit is a sacrifice. Connecting it back to the Dr. Tosin's presentation about substance use. Substance abuse runs in my family, for example. And this was one of the major factors that encouraged me to let go of those particular habits. So that was a sacrifice. The choice to say, I'm not going to drink alcohol. The choice to say, I'm not going to smoke. The choice to say, I'm not going to engage in the same self-destructive habits that run in my family line when it comes to diet. I'm not going to engage in the same destructive mental and emotional patterns that run in my family line. Those are sacrifices. The ability to face the dark spots of my consciousness, the ability to face my fears inside, to say, instead of running from this emotion, running from the situations in life that trigger certain emotions in me that I don't want to feel, sadness, depression, abandonment, whatever it may be. We all have scars in some way. Usually we do. Maybe not everyone, but it's probably most of us have something, an impact that our life has made on us that wasn't the best from our upbringing, our experiences that have happened to us. The sacrifice is to say, I'm no longer going to live in a way where I'm avoiding those things. I want to be free from those things. So the sacrifice is embracing those experiences. The sacrifice is allowing yourself to feel those things instead of either trying to avoid them completely or doing something to cope with those experiences. It's that type of sacrifice that we utilize in connection to our psychological experience that frees us from those experiences, allows us to transform those tendencies, to transcend those conditions within ourselves. We learn through those sacrifices more productive ways of moving throughout our life. You see, so this is sacrifice. It turns towards the work that we have to do within ourselves, ultimately. And it could also be dealing with the things we have to give up in our life. If I have a habit with something, a self-destructive habit, I need to stop doing that particular thing. That's outside of me. I'm in an unproductive relationship. I need to get out of that relationship. I choose to associate with people and places that are not uplifting my soul. I need to stop hanging out with those people. I need to stop going to those places. I need to learn to no longer be influenced by those things. And whatever it takes for me to develop the inner power, the inner resources to do that is a sacrifice. It might take time. It might take money. It might take a lot of effort. It might even take going through some pain to develop that capacity to walk away from those people or those places or those things. That is the sacrifice. The sacrifice, there's no sacrifice in running towards the substance. There's no sacrifice in doing something to avoid facing these aspects of ourselves. So there's a big misconception oftentimes when it comes to, we hear the word sacrifice in the tradition, because we think it's about, something, always giving something physical, doing something physical. It's about what we're willing to sacrifice within ourselves, what we're willing to let go of, what we're willing to embrace, learn, spend our time doing in order to shift the direction of our life. So whatever we need to do in that sense is the sacrifice itself. Embracing our ancestral monument, embracing our Isheshe is not always an easy thing, because there's a lot of pain there. There's a lot of turmoil there. That's the sacrifice. Facing those things, embracing those things. Using our Isheshe, using our ancestral inheritance, using the conditions that we were put in growing up through our parents, through our family, using those things as the fuel for our journey, as the means to awaken our consciousness. That's the sacrifice. You see. So I hope that makes it clear.
It did cover a larger part of while I was questioning that, because we get it mixed up, particularly the word, it's scary. It's almost diabolical when people say, oh, you know what, because in Yoruba land we call it ebo, right? It's the same thing as sacrifice. People hear ebo and they run. It doesn't matter where. It's as like you're committing something sort of tragic, sort of something a taboo in a way. So, as my role, as what I've been trying to do to explain to people, like, every step you take, almost like you have to kind of do some sacrifice. It essentially don't have to be through the traditional Ifa or even the, we have a set in Nigeria called Celestia, which they do a lot of sacrifice methodology in their practice. But when people hear this, it kind of make people want to run and scare. So I'm glad you kind of put a little bit of context on that. Do anyone have question for Oluwo? Oluwo, it'll be a special privilege if you can send us out with some kind of meditation, because it's one of what the team wants. They've asked me of you, they've heard you do that before, and they'd be like, this is something that everybody should take a blessing from. But I wonder if there's questions and a lingering stuff that people want to ask before we let you do that.
Okay, yes.
Okay, I don't think there are questions from anyone. I don't see hands raised. If there are no hands raised, I think we should go straight for the long-awaited meditation session.
Before that, Oluwo, in your mind, when you're trying to do this meditation, we lost a student of ours, a friend, a colleague. And actually today is a memorial for him, right? So Loretta is in school right now and Titi is there. They're going to help. I'm in DC trying to do this conference, but they're there to help help the parents that are coming over. So let all of us in our mind, as we do this meditation with Oluwo, kind of send some goodwill to his name is what is his name again, Loretta?
His name is Jogo.
Help send some good wish to Jogo wherever he is right now, wherever the spirit is right now. May he find peace as he continues his journey onward. Let's put that at the back of our mind as we listen to the meditation. Thank you.
Yes, my condolences to your colleague. So let's see, what could we do as a form of practice that aligns with what we talked about? Practices take a lot of context. So I'll give something that's approachable, relatable to what we talked about. And this would be a very simple practice. A simple practice of acknowledgement. A simple practice of acknowledging what we have, what we were given, what we were provided with from our Isheshe, from our closest Isheshe, our family line. We wouldn't be here today without our parents. We wouldn't be here today without our grandparents. We wouldn't be here without the foundation that they gave us, the legacy that they gave us, the positive and the negative, all the positive influences that they've had on our life. And even the challenges that we've faced, that we've endured, that actually help to shape who we are today, that come from our family line. So this practice will involve us doing two simple things. It will involve us first connecting at the level of the heart. This is what the Yoruba call Oriegbe. We'll connect at the level of the heart. And then from there, we'll begin to express silently as not necessarily in terms of words, but something that we do from our heart that's expressing an energy of gratitude towards our ancestral line for all that they've provided, for all that they've done to pave the way for our life today, for all that we have experienced through them that has shaped us into being who we are today. There's so much to acknowledge. And this is a very simple practice of, you can say, connecting with your ancestors. It's just simply acknowledging the role that they've played in your life and having a sense of gratitude for all that was. So this is what we'll do. It's a very personal practice, as we all have different ancestors, different family lines. So it's very personal. So with this practice, we'll be closing our eyes. We'll sit up with the spine straight. And then I'll lead the two main phases. So let's go ahead and do that. Let's go ahead and close the eyes. We sit with the spine straight. And we center our consciousness, our awareness at the level of the heart, just right in the center of the chest. This is Oriegbe. No thoughts, no distractions. Just keep your focus at the center of the chest. Now, starting from the statement that one's father is one's Isheshe, let us direct our awareness and our attention towards the influence that our father or father figure has had in our life. We simply acknowledge within our heart, at the level of our heart, the influence, the support, the love that we've experienced in connection to either our father or father figure. We do this while staying centered at the level of the heart. We don't lose the connection with the heart. Everything is being done from the heart. We do this on a background of a state of gratitude for all that was, for all that we have, for all that we've been able to become in connection to our Father. And now starting from the statement that one's mother is one's Isheshe, we apply the same acknowledgement and state of gratitude towards everything that we have experienced, gained, learned in connection to our mother. And now let us acknowledge the influence of our ancestors extending beyond our parents, acknowledging the influence that they've had in our life, being centered in the heart, we manifest this state of gratitude globally towards our entire ancestral lineage. And now, keeping the eyes closed, just take a moment to become aware of the effects of the practice itself. How you feel within your body, your mind, your emotions. Even at the level of your consciousness. And that's good. You come back. This is a very simple practice that we can do at any time towards our ancestors. It's actually very, very effective. It can even be used. You can say some of the deeper effects of this practice can lead to healing relationships between you and your ancestors, between healing your relationship with certain experiences that you've had in your life, in connection to your family, in connection to those who have come before you. A lot of times things are left unsaid, things are left undone in connection to those who have departed, or even in connection to those who still live in our family. Oftentimes, this is in relationship to the things that are difficult, the challenging experiences that come in our life through our parents or through our family, those who have passed. But if we can change our perspective upon the experience itself, and to not take anything personal in our life that happens to us through our family line, we can understand that everything is happening in our life for a reason. Everything is happening in our life to help elevate our consciousness. Everything is there to bring us what we need to help push us forward in a certain way. And this is coming oftentimes through unpleasant experiences with our family members. This state of gratitude towards the challenging experiences in our life, it has a way of alchemizing, you can say, the energy or the impact that those experiences may have had on us negatively. So it's a practice that teaches us that things are not happening to us in our life, things are happening for us in our life. This energy of gratitude, this heartfelt emotion, this is a very powerful energy. When we're able to hold a state of gratitude towards the most difficult experiences that we've had, it has a way of transforming or changing the quality of that energy. It allows us to see the meaning behind that particular energy in our life, the meaning behind the experience that brought us that energy in our life. And if we are at odds with someone in our family, if we are at odds with someone who has passed on, it's usually because we haven't been able to open ourselves to what we've experienced through that person, to either something that has happened to us or either something that didn't happen that we wanted to happen. We hold resentments. We may even have some form of hatred, dislike. But the more we connect with our essence, the more we connect with our Isheshe. This was the value of centering into our heart. The more we connect with that, the more our perspective will change upon our life experience, on what's happened to us in our life, why things are happening in our life. it teaches us to have a superior perspective upon our life experience that leads to a completely different relationship and understanding of that life experience. And that has the capacity to not only transform, alchemize the impact that that experience has had upon us, but it has the ability to transform, to heal the relationship with the individual or individuals who may have been involved. So this is a very simple but very powerful practice. So I hope that you could feel it, that you could sense it, and that it was meaningful. We did it for a very short amount of time. So if there are any questions or comments about your experience, please feel free. One thing I'll share also is that when we have this gratitude towards our mother, our father, or towards our ancestors, towards a particular ancestor, doesn't matter. Oftentimes, we may be having gratitude towards the things that we appreciate about that person. But in that gratitude, when we direct this practice towards a particular person like that, what happens, what can happen in deeper phases is that you start to become aware of other aspects of your experience with that individual that you may not have remembered. It can start to unlock certain memories, certain connection with that person. Key experiences that you may have buried in your subconscious mind that may have impacted you and may even have created ties or knots that prevent you from being all that you're meant to be, from being able to express yourself fully. So we have to be open to what comes in this practice. Certain ancestors may show their face. Certain ancestors may come. Because there may be some unresolved business. There may be some healing that needs to take place with a particular person. And it's important to embrace that as it comes through this practice. The practice has a way, this knowledge, this inner knowingness that we connect with at the level of the heart, has a way of showing us where we need to bring our attention, where we need to bring our awareness. So this is a very effective practice. Thank you.
Olivia has a hand raised.
Olivia, yes, please.
Hello, I was just going to say thank you for this. I really feel a difference when we do the heart centering meditation, like in a group. Like you can just feel a strong energy and a connection to your ancestors. So I appreciate you doing this for us. Thank you.
Yes, you're welcome. Thank you for sharing. Chad, please.
Yeah, I would just like to also echo gratitude. Thank you. You're such a good teacher, and so I appreciate all the time you put into this. And I just wanted to highlight, I appreciate, underscore the use of the word appreciation and your reminder that appreciation doesn't mean liking sometimes, right? Or like things don't necessarily have to like feel good in order to be beneficial. So yeah, I appreciate that reminder.
Indeed, you're welcome, Chad. Thank you. Some things may not be so pleasant in our experience, but having this gratitude for the presence of that experience in our life, understanding that it's serving a role, it's serving a purpose in our life, in our growth, in our transformation. We don't have to necessarily like what happened. And what happened may be something that is not worth continuing on. It may be something that we completely need to break free of. a cycle, a pattern that we need to put an end to. And this type of gratitude towards the pain of our experience in life, it helps become the invitation, the doorway towards breaking the cycle. And when we break the cycle, we break these patterns in our life, especially the ones that come in connection to those who have come before us, our ancestors. We're actually helping to free them in a certain way. We're here to carry out the unfinished business of our ancestors. We're here to carry on their strengths, to even evolve their strengths, turn their strengths into something greater. We stand upon their shoulders. But we're also meant to put an end to certain cycles, to certain patterns, to certain tendencies, certain ways of moving throughout the world, our lifestyle, you see. So all of this is a part of our ancestral work. All of this is a part of what the Odu, O'Connor, and Obara said, making the sacrifice so that our ancestral monument does not die. You see? By carrying on the strengths of our ancestors, the monument does not die. But by breaking the unproductive patterns that we've inherited from our ancestral line, this also serves for that ancestral monument to continue, for it to not to die. So this is a very, very powerful practice, very practical what we see in the verses of Ifa. Depends on our perspective, how we look at it. So what sacrifices do we personally need to make to continue that ancestral monument? To continue to add, to evolve, to expand upon the power, the beauty, the strengths of our ancestors? And what sacrifices do we need to make to put an end to certain cycles? You see, our ancestors are congratulating us either way. And this is a big part of our ancestral communion, which is a big part of the Ifa tradition, for example. It's a big part of indigenous African systems, ancestor veneration, ancestor worship. You see, and it can be very, very practical. It can be as practical as us looking at the dietary habits of our ancestors. I have a lot of people in my family that had, prostate cancer, that had kidney failure, dying at young ages, dying in their 50s, dying in their early 60s from disease that were directly rooted to the diets that they had their whole life, which was passed down to them by their parents. A part of my ancestral work is to stop indulging in those habits, to change those patterns, to break that cycle, to preserve this physical body, this vessel, which is an extension of them, to pass down stronger genetic traits. You see, that is also an ancestor. You can see a part of the ancestral work. So it can be very practical things.
Thank you so much.
You're welcome. Thank you. Thank you.
We're really, 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 really grateful for the time. This is really a healing session. I think it's a very good way to wrap up how we started this morning, and reflecting on our lives, on our ancestors, and how we live now and the community we live in. It's a way to go. It's the right direction we're headed, like Olivia said. So thank you so much, Olivia. We really appreciate your time. We know money cannot, the whole money in the world cannot, if we give you the whole money we have right now in the world, it's not enough to say thank you. This is much more than money. It's much more than, it's your time, it's your knowledge, it's your gifts that you've shared with us, and we do not take it for granted at all. Especially for us that know how much this is sacred and special to us and to our culture. So thank you so very much. Dr. Mashood, will you please do the honors of wrapping this up and so we can release people to go? But before Dr. Mashood comes up, I want to say if you're in Chicago or you have a friend in Chicago who is also affiliated to what we're doing today, we have a post-series get-together where we want to break bread together and share some African meals together somewhere on the South Side. So if there's anyone you know you will want them to come join us, please. We'll start at 5 p.m. later today after the memorial of our colleague that just passed on this afternoon. So if you just, I would leave my number in the chat box and you could ask them to call me and I'll give them the direction address of where to come break bread with us. And let's dine together as a community. Communal eating, communal living is all we know is a bedrock of the African culture. So please, we are happy to have people join us to dine and wine together today. I will just leave my my phone details in the chat and they can just reach me and I can direct them to where we'll be having this. So thank you. Dr. Mashood, over to you.
I have nothing but gratitude for everyone that shows up. It was a bit risky to do this, to mix it up. I was given an opportunity and I imagine this is recorded, and in academic space, if you're in that space, you know what I mean by it's risky trying to bridge these two gaps together. And I hope for the benefit of all of you here, the people that will receive this is not even just us here, because it's recorded. It's people that will watch it later and run with whatever it is covered here today. It's documented so they can see, they can hear that the times are urgent. We need to slow down. It seems like we're all caught up in a rat race, something that is taking away all of the beauty of what we can do as humanity. So you can imagine what is happening in West Africa right now. My heartfelt prayers and well wishes goes to that corridors of the world, because, not only because I'm there from there specifically, but because humanity is at stake if what we are hearing goes wrong over there. So for us, all we can do is sort of slow down, help process this and send good wishes, and hope something is going to reverberate and something will be averted. Hopefully that will work in our favor. But beyond that, I'm super, 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 super grateful that we can hold this section. And then all I can say is look out for more. I'm sure we have the resources to do this. It's just been, how do we start it? And we start with the Sheshe, so which is Oloriud. And I'm grateful that we were able to cover many of these. So we'll go from here and we'll see what we can do. Thank you.
Thank you everyone for coming. Officially, we've ended this meeting and
Thank you,
we'll stop
everyone.
recording. We'll stop recording. Thank you so much, everyone.
Thank you so much.
Thank
Thank
you.
you.
Thank you all
Thank
so
you.
much. It was beautiful.